Case number 1. A 16-year-old male with a history of frequent painful episodes and anemia presents to your clinic. Blood tests revealed abnormally shaped red blood cells. This patient's condition is most likely due to a mutation in which gene? A. Alpha-globin gene. B. Beta-globin gene. C. G6PD gene. D. Factor V Leiden gene. Correct answer. B. Sickle cell disease is caused by a mutation in the beta-globin gene, leading to the production of abnormal hemoglobin, known as hemoglobin S. This abnormal hemoglobin polymerizes under low oxygen tension, causing red blood cells to deform into a sickle shape. These sickle cells are less deformable, leading to vaso-occlusion, hemolysis, and the various clinical manifestations of sickle cell disease. Unlike mutations in the alpha-globin gene, which cause alpha thalassemia, the beta-globin gene mutation specifically results in sickle cell disease. G6PD deficiency and factor V Leiden mutation lead to other distinct hematological disorders.